Good Saturday morning to you all. Thank you for joining us for day 2 of the Black Health Summit. My name is Paula Brown and I am the Chief Operating Officer at the Center for African American Health. And before we pass the baton to our all-star panelists, just want to encourage each of you as participants to ensure that you jot your questions down in our Q&A or our chat, as our panelists have agreed to field questions towards the end of their presentation. And so with that said, I'm going to pass the baton to our panelists so that they can get us started.
Jason, would you like to start?
Yes. Good morning, everyone. Thank you for being here on a Saturday morning. My name is Jason Vitello. I am the Behavioral Health Coordinator for Denver Public Health and the President-elect of the Colorado Public Health Association. I'm here with the community leadership team, Denver Public Health's community leadership team for public health for public safety, which is a community movement to engage and heal crime survivors. So you can go to the next slide. So we'll be presenting today on the Public Health and Public Safety Initiative. It's funded by the Community Crime Victims Service Program. This initiative upholds that public safety should not just be a matter of law enforcement and the criminal legal system, but a matter of public health. And the response to crime shouldn't just involve cops, courts, and cages, but culturally responsive, community-based alternatives. And that the problem of crime and violence should be addressed not just through punishment alone, but through restoration, healing, and prevention. In light of the year we just had, 2020, and some of the residual in 2021, we saw a lot of tragic events related to our criminal legal system and police brutality, and sweeping national and international demands for reform and resource reallocation. And hopefully now the ideas presented here will be a little more resonant in the mainstream social and political discourse than they were before. We find ourselves in a really pivotal moment in time, and public health for public safety aims to be more than a movement, but part of a much larger, rather more than a moment, but part of a much larger movement. So I'm going to say a little bit about the background of our initiative. And it began back a few years ago. I was collaborating with the CCJRC, the Colorado Criminal Justice Reform Coalition, and part of their Crime Survivors Initiative. And it was in 2016. And I partnered with the Crime Survivors Initiative, and that program kind of culminated in the publication of the Crime Victims Report, which oversampled people from underrepresented backgrounds, men and male youth, and people of color in particular. And the findings on the report were, as indicated on the screen, that crime and violent crime included disproportionately impacts minorities, ethnic minorities. Only about a third of the crimes are reported. Most people don't ask for help. There's a perception and a belief shared across all demographics that ethnic minorities are treated differently within the criminal legal system, whether they are victims or offenders, and also across all demographics, the belief that rehabilitation is better than punishment. So prevention programming, rehabilitation, and community-based and culturally responsive programming was preferable to the current status quo. Next slide, please. So that report was instrumental in the passage of House Bill 1409, which reallocated about $850,000 a year out of Department of Corrections into the Office of Violence Prevention at the State Public Health Department. And that's where our funding comes from. Public Health for Public Safety is a community movement to engage and heal crime survivors. And again, we uphold that public safety should be a matter of community and public health as much as it is a matter, I would say even more, a matter of law enforcement and criminal justice. Our mission is to reduce violence and to promote healthy masculinity, trauma-informed, gender-responsive interventions, individual and community healing, and systemic transformations. Next slide, please. So when we say public health, I think it's important that we kind of ground ourselves in understanding what exactly that means. Because I don't know that I could have articulated public health before I was a public health professional myself. I like to use the metaphor of the well, right? So imagine there's a village with 100 people in it, and there's a well, and all 100 people drink from that well, and 98 of them get sick. The medical approach is everyone lines up and gets a pill, gets some medicine to treat the symptoms of, whatever it was that they drank. Whereas the public health approach is figuring out what's going on with that well, right? Public health is officially defined by the World Health Organization as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. Next slide, please. And again, health is not just the absence of disease, but a state of wellness. And we also talk about the social determinants of health within public health. And these are based on the understanding that health happens and health is determined by far more than one's personal decisions and what happens within the walls of a healthcare center or a hospital. Your health is largely determined by where you live, what kind of access you have to healthy food, what kind of access you have to quality education, walkable, healthy communities, safe environments, and so on. The public health approach to violence prevention is the same as its approach to all population level problems, right? We seek to define the problem, identify risk and protective factors, develop or identify and test prevention strategies, and ensure widespread adoption. We believe that the problem of crime and violence is complex and sophisticated, and we can't arrest our way out of it alone. So, as I mentioned, our Public Health for Public Safety leadership team, it's a dynamic team of individuals. We've had between 10 and 12. These are all amazing folks that you're gonna meet several of them today. But they all have lived experiences related to violence and victimization, and bring very, very powerful perspectives to this work. We've engaged in a process of community-based participatory research, and we really attempt to give the keys to this initiative to the leadership team. And one of the things that we've executed on was our Public Health for Public Safety report. Our leadership team was instrumental in the design of the questions, the promotion, the outreach, and even writing the report itself, the provision of personal testimonies, right? Which we know sometimes when we speak about our own experiences, it can come at great emotional expense. So we were very grateful that they are willing to give in the sharing of their testimony for the benefit of the rest of us. But what we were trying to do was ultimately do a deeper dive and do essentially part 2 of that crime victims or the Victim Speak report that I referenced initially. And again, just providing a little bit of context, and I should have said this off top, but it's Saturday morning. Traditionally, when we talk about victims services within the service provision arena, within the courts and legal system, usually that narrative is centered around the experiences of, frankly, battered white women, right? And we know that that's important, but it has left out and kind of silenced an unseen and unheard demographic of individuals, namely people of color, right? From impacted communities, men and male youth of color as well, right? So we, again, oversampled from this population to learn more about an untapped audience and community. And we wanted to explore what motivates people to report or not report a crime or crimes that they have experienced. What are the experiences of those that have reported a crime or crimes? And what are the experiences of those that have interacted with the criminal legal system? And what is the community perception of law enforcement? Next slide. So now my friend and colleague, Erin Harris, is going to share a bit about our methodology. Thank you again.
Good morning, everyone. Again, I'm Erin Harris. I am the evaluation support for this leadership team group, how we collected the survey data. A second, it seems to be a little frozen. There we go. So we began by, can everyone hear me? I got a message that I'm breaking up. Kind of okay. If not quite, I'll try taking the phones out and see if that helps. Is that better? Okay. So we began with the leadership team. They reviewed that crime victim survey report that the CCJRC presented, and also a similar report out of California. We then brainstormed answers as a group. What surprised you? What was concerning to you? What do you want to know more about? And what was encouraging to you? And the leadership team, as they read through those reports, they made notes of this and then came together as a group and brainstormed their responses. We then categorized our answers into this in larger categories and themes, and then prioritized which of those the leadership team felt was the most important. We then went through a process where we followed a process to understand kind of what we wanted to learn, who we wanted to learn that information from, and how we wanted to learn that information. And the leadership team decided that a survey was the best first step to understand what motivates individuals to report or not report a crime they've experienced, the experiences of those that have reported a crime, the experiences of those that have interacted with the criminal legal system, and the community perception of law enforcement. And the next step that will be coming is doing focus groups to dive deeper into this first step of the survey. We distributed the survey over a period of 12 weeks. It was from November 24th, 2019 through February 14th, 2020. And through social media, email, text messages, and some in-person events. And then we had a total of 240 individuals that responded to this survey. We analyzed the data primarily using Qualtrics and Excel. Qualtrics was the survey platform that we used to distribute the survey. And then a small team of the leadership team worked with me to get trained in thematic coding, and we analyzed our qualitative responses using that information. And just to give you an idea of who we surveyed, when looking at race and ethnicity, it was predominantly Black, followed by white, non-Hispanic, and then Hispanic Latinx. Those were our predominant individuals, their race and ethnicity. Looking at age groups, we had fairly even spread over age, with the exception of those 66 years and over. So when looking at age categories, it's pretty good indication that there was even spread. And then we did collect information on highest level of education. We did not use this in our analysis because the leadership team pointed out we had originally were going to use this as a proxy indicator for income, but our leadership team pointed out that there can be people that are very well educated but still be have lower incomes. So we did not use this in any of our analysis, but just to show you the education level of those that we surveyed, predominantly high school GED and some college, with a smattering of those with associate's degrees, bachelor's degrees, and master's degrees. So now I'm going to turn it over to Marcus to discuss our key findings and differences in victimization.
Hello, good morning. I'm going to go over a couple of key findings that we have found. Next slide, please. So the first key finding that we found was that 8 out of 10 individuals reported being a victim of a crime in their lifetime, and with most of them being people of color who have experienced them crimes. Next slide. We also found that individuals between the age of 26 and 35 and people of color reported the highest rate of repeat crime, repeat victimization. Partially is that due to underreporting. So not reporting it the first 1 or 2 times that it happens more than likely leaves room for that to happen again. As you see in the quote that we have below, it says, "I was physically assaulted and reported it 1 time, but many times I did not." So that means it's leaving room for that to more happen because people are deterred from going to report. Next slide. So we also found that people of color disproportionately experience violent and nonviolent crimes, and more specifically, men. Yeah. And then I'm going to pass it on to my colleague, LaToya Petty.
Good morning, everybody. My name is LaToya Petty. I have been with the community leadership team with Public Health or Public Safety since we began, so a couple of years now, I guess it's been. Very excited to do this type of work. Been working in the community for over 25 years. I'm the current mental health grant manager for my Vitello organizing committee, and I sit on the Denver African American Commission, and I'm also a board member with the Denver Sheriff's Department. So I am just going to kind of jump into some of the inequities of the criminal justice system. It's a deep subject. We're just going to skim the top of it just a little bit. And then one of our focuses moving forward is that we will get a little bit deeper into some of these key findings that jumped out of it. So the next slide, please, Erin. So our first key finding in the inequities of the criminal justice system is that 1 out of 4 respondents didn't receive any services for the crimes they experienced and reported to law enforcement. And that's a pretty deep key finding because as we were reading and collecting information, we found that just interacting with law enforcement for a lot of the people who took the survey was a very traumatic experience. And it caused them to have a lot of PTSD and everything like that coming out of it. And the ones that were able to actually receive some therapeutic services or just something to follow up with their experience with law enforcement said that that was the thing that helped them get through it the most. So whether they were witnesses, whether they were victims, whether they were perpetrators, when you're interacting with law enforcement, it causes, it can cause some major mental health issues. Next slide, please. So our next key finding is that 80% of respondents were not aware that you do not have to report a crime to law enforcement in order to receive services. And this is so interesting to me with the work that we do, because I know that when I first started out and just interacting with society in the way that I did growing up and stuff like that, I definitely thought that in order for me to receive the type of services or to even be considered for any type of help, I would have to have something traumatic or bad or whatever happened to me. And then there will have to be a report written up, and then somebody would refer me to the system and everything like that. It's so interesting that that's not what needs to happen. So really, if you need services, or if you know somebody that needs services, all you have to do is call a number and you'll be able to get those services that you need. And you don't actually have to report a crime. Next one. So key findings 3 and 4. Being a victim of a crime is significantly associated with having committed an act of violence. 9 out of 10 victims also committed an act of violence. So that goes with the little cycle or circle of violence that is very significant in communities of lower income. And it's a very hard one to break. And then the next one is repeat victimization, significantly associated with having committed an act of violence. So if you guys look over here at the little graphic right next to it, we have, this is the simplest, easiest graphic that I could find that kind of highlighted what exactly it looks like with how our society kind of interacts with each other on this level. So we have victims, offenders, community, and this little happy face right there in the middle. So we are all kind of engaging with each other on some level. So where do we find that happy space where everybody's able to take advantage of the resources that they need to move forward and to be productive citizens in life? All right, next slide. Okay, key findings 5 and 6. Number 5, people of color and men are most likely to have reported interacting with the criminal legal system. I don't think that's a surprise to anybody. Number 6 is 6 out of 10 that have interacted with the criminal legal system did not receive the services that they needed, such as mental health services and legal services. And I just kind of spoke on that a little bit about how important it is for people to actually receive services. And I'm not putting down our service people, because I think that they're the saviors of this whole system. So it's not that they're not out there busting their butt doing the things that they're needing and being providers. It's more that we need more of them. We need just more and more and more of these people reaching out and more touch points within the community. Next slide. Oh, and now I'm going to hand it over to Michael Filmore, who is going to talk a little bit about reporting of crimes. Take it, Michael.
Hello, everyone. I'm excited to be with y'all today to sit on this panel. I am 19 years old. I'm one of the youth on the community research team. I've been with the community research team since the movement began. And so we're going to talk about reporting of crime. First, we did research on whether or not an individual reported a crime to law enforcement. 56% people said yes, 44% of people said no. And in our key findings, we found that slightly more than half of the respondents had reported the crimes that they experienced. And then the second key finding was top reasons for reporting were concern for safety, feeling like they had no choice, to recover property, and wanting justice. Next slide. Okay. Another key finding that we had, our third key finding, was experiences reporting crimes were mixed. For those that had a bad experience, it was mostly due to a lack of follow through by law enforcement and being treated like a criminal when they were a victim of the crime. This led to many saying they might or would not report a crime in the future. And we see this play out, in so many different situations. A lot of times we go to police thinking that they're the ones that's supposed to protect and service and follow through with our justice. And most of the time we don't get that return. Even sometimes we end up in the system being on the other side, even though we are a victim in a situation. We can go to the next slide. So our fourth and fifth key finding was, our fourth one was Those 16 and 25 years old were the least likely to have reported the crime that they experienced. So we see this in our younger adults, our youth. And then also many people of color were less likely to report crimes that they experienced. Back again, this is also because, you know, it's a culture that we don't believe in the system, but it has played out in history. You know, something that has shown us to deem itself to be true and factual, that this system does not work for us. Many respondents reported having a good experience. However, many also had bad experiences when reporting. And we got some quotes from some people that I like to read off. It's discouraging when you report a crime, but there's no follow-up, or the assailant isn't held accountable. So we're talking about accountability. Also, somebody said the times where I actually reported, I felt like I was treated as a perpetrator. There was no support. I walked away feeling as though I had done something wrong to deserve the outcome. We can go to the next. Okay, and our key finding number 6, the top reasons given for not reporting a crime were a lack of confidence in a legal system, mentality that it could be handled on their own way, and a lack of clarity, uncertainty, and understanding. About half of the survey respondents that have reported crimes in the past that they may or may not report crimes again following their previous experience. Again, that lack of confidence in our system that has shown to not protect and serve us, that people feel like we have to take our own measures to get the justice that we need. Guns in our community, that we felt like we have to go to the fullest extent to be able to get the justice that we deserve. Or the protection that we need for our families. Experiences such as those described by a female young adult may be a large cause of underreporting, and our respondents being uncertain if they would report again in the future. There was a quote, "Reporting was almost worse than being raped. There was alcohol involved, and I was underage, so the police officers treated me like I was the criminal. They also treated me like being raped was my fault. This led to me being extremely shameful of what happened to me. All of this reason being the reason I did not report the second time." So there's a lot of things that are going on in our community, serious things that are going on in our communities, but our young women, our young men are feeling like we cannot go to a system that will serve us because we will then be at fault, or these things will then turn to us, you know, even though we were the victim in the situation. Under 35 years old, we're less likely to report. Like I said, we see this in our youth. This is a trend that's happening in our youth. Those 16 to 25 years were the less likely to report, with 30% not reporting the crimes experienced, the highest number of non-reporting among all age groups. We took research whether or not an individual reported a crime experienced by an age group, and like I said, 16 and 25 were like the most less likely to report. And we say why. We can go to the next. And we say why. Why don't our communities report crimes? Why are they not going to a law enforcement system that is supposed to be there, right? The most mentioned reason was a lack of confidence in the legal system, mentioned most by 16 to 25-year-olds and Black respondents. Quotes like, "The cops never listen to the small Black girl. Any cop or reporting services never care for minorities." And we can see this, you know, through Breonna Taylor. We can see this through Philando Castile. We can see this through Trayvon Martin. And you can see why our youth don't go to a law enforcement, because, you know, as for our Black males, me being an African-American male, I can say I've never trusted, you know, a system that I feel like, you know, it endangers me. You know, I've did my things, I've did my wrongs, you know, but I've never had a good experience, you know, and some of my most traumatic experiences in my entire life was me, you know, even showing up to a police station, me even being in handcuffs. You know, that's not an experience that I wish on anybody, even if I was innocent and I was wrong. You know, the relationship between communities and police It's just not there. We have police sitting in our communities every single day. But I don't know none of my neighborhood police officers. I don't know none of them. You know, the most people only learn to meet police officers when they're arrested or they're handcuffed. And instead it should be a relationship where I could come to you, where I could trust you, where you feel like I feel like you're a community member, and that's just not what it is. It's a broken system that does not serve us. And so now I'm gonna turn this over to my colleague, Ray. Thank you, everyone, too.
Hi, good morning, everybody. Thanks for having us here at the, at this new summit here that we're trying to get the word out. Basically, my name is Ray Gallegos. I've been with the community leadership team for, a couple years now since it started. And I've been a community activist, advocate. Oh, hold on. I'm seeing that you guys can't see me on video here. Is that better? You guys see me now?
It's just very dark, Ray.
Oh, okay. All right. I just wanted to make sure. So
You're like
basically,
one of those crime documentaries where they black out the witness's face.
oh, is you guys don't have the voice disguiser on me? So basically,
we can arrange that, Ray. Hold on. Sorry, go ahead.
no, it's all good. We're actually, just like Michael was talking about, the underreporting of crime has a lot to do with the perception of law enforcement. And in communities of color, I'm sure everyone is familiar with a lot of the stigmas that surround law enforcement and how they treat people of color and profile. And, that has a lot to do with the reporting of crime and how people see law enforcement. And I think one of the things that we really need to do is, kind of get into the reason behind that perception of law enforcement and why people feel that they can't go to law enforcement and they can't trust their own officials who are here to help them. And, this section here is basically how people do see law enforcement in their communities. And again, that has a direct relation to how exactly they interact with law enforcement, how they're treated, and also how they report crimes. You can go ahead and go to the next slide, Erin. So in our research, we found that 4 out of 10 respondents reported having a negative perception of law enforcement, and this was almost double among people of color. Again, it's I don't know if it's a cultural thing, if it's economics, or if it's just how the community was raised or experiences. Because I know, there's a lot of people who haven't actually had direct experiences with law enforcement or the legal system, but yet they still have that perception of police not being here to help them and here to put them in prison. The second key finding that we also found was individuals that were aged 16 to 25 were the most likely among all age groups that we surveyed to have a negative experience with law enforcement. And again, that comes to some of our community members who feel that police are profiling them and are out to get them, and it leads to a lot of negative stereotypes and perceptions of people who are put in the communities for safety issues. And I think it really blurs the line of what law enforcement is really here for and how they can help. Go ahead and go to the next slide. 40% of the general public have a negative or an extremely negative perception of law enforcement in their communities. And I'm sure everyone has also seen what's going on in the news lately, the past couple months, as far as the unrest and, how law enforcement has been conducting themselves in the public. So, you know, the media, I feel, is really given a voice to people who have been victimized over the years from law enforcement. But it also, on the other side of the spectrum, it also, I think, feeds into the negativity that people see from law enforcement. And I think that that's something we should really work on, trying to change the relationships between the public and people here who took an oath to protect and serve the community, not just the upper middle class, but also the lower income communities as well. You can go ahead and go to the next slide, Erin. So although 8 out of 10 people of color have an extremely negative perception of law enforcement, 65% of all the positive perceptions and interactions of law enforcement were actually from people of color. So, you know, regardless of there being a lot of negativity from people of color as far as law enforcement goes, 65% of the positive surveys that we got, you know, concerning law enforcement were, of course, from people of color. And again, this does come back to, you know, our over surveying of people of color, because, you know, our communities, I feel, are the ones that are most impacted by a lot of the systematic, systematic injustices and discrimination that goes on in the criminal legal system. You go ahead and go to the next slide for me, please. Again, young adults ages 16 to 25 reported the most negative perception of interactions with law enforcement of all the age groups we asked. And, you know, again, it just comes back to the community and how we view people who are here to protect and serve, and how we feel about just the general targeting of younger people who are, you know, in the community and not necessarily even given a chance to, you know, not necessarily given a chance to prove themselves to be contributing members of the community. Rather, they're just looked at as thugs, or, you know, troublemakers, or people who are, you know, don't have anything to give back to the neighborhood. And you know, personally, I really feel like this is another very important thing that we need to work on as a community, and as you know, with our group, our leadership team. I'm really hoping that we get into the I guess the nurturing of the younger people, and also being able to bring them on board and teach them that there are other options out there to make a positive change in their community, and be able to contribute to their community, whether it's mental health or, you know, economically. Being able to have those opportunities is very important to younger people, and have a sense of purpose. You could go ahead and go to the next. Okay, and for the next steps, I think we're gonna have Henry. Is Henry here?
I am, right.
All right, so I'm gonna go ahead and pass off to Henry. Thank you all for being here, and I appreciate it. Thank you.
Good morning, everyone. My name is Henry Price, the Community Engagement Organizer for Colorado Criminal Justice Reform Coalition. I also have been a part of this community leadership group through partnership through Denver Health and the CCBS grant from its inception. And also I am formerly incarcerated, so I do fall in that cross-sectionality of both, and as an offender and a victim of trauma and crime. Some of the things that, you know, you guys have probably heard this morning in this report are not that earth-shattering or shocking. These are lived experiences for most Black and brown folks and marginalized folks in the community. And so some of the things that we have recapped, we looked at serving to kind of justify what would be some of the things that we would have as asks. You know, some of these are suggestions, but they're really asks. And we wanted to kind of get a real comprehensive platform moving forward, and how we can enact some of this data, how we can put it into community, and how we can really see some change happen. You can go to the next slide, Erin. Some of the things that we wanted to look at from our policymakers is increasing funding. And as Jason intimated earlier, even with the leading crime victim services, the advocates, they're traditionally for, middle-class white women who have gone and gotten the ear of folks who create, make, and change policy in our community. And the effect of that has traditionally been more cops and cages for Black and brown folks. Tough on crime. We've all lived through Reaganomics. We all lived through, the crime bill of '94, and really understanding what those things have done to trickle down from the federal level all the way down to our individual communities where we live. We want to start getting the ear of our policymakers. And so some of you on this call, you're able to do those things. There are actionists in community. I like to call them actionists, not activists, because they really do make things happen, that are out there who are really advocating for community at a level that is unheard of before. They're getting the ear of Black and brown, and some folks who are, not Black and brown, that are across the line, that really see that there's a time to change. So increasing funding for culturally relevant and gender relevant services for victims to broaden accessibility is one of our acts. We want to create policy requiring ongoing comprehensive cultural and diversity inclusion training. Everyone's familiar with DEI, mental health, and de-escalation training for law enforcement agencies. Some of that work has already been started. There's legislation that's been passed, and there's also other talks of policies and bills being introduced to help, further some of those efforts. And also in that space, we want to create policy that requires mandatory counseling with additional evaluations every 6 months for law enforcement officers. A lot of what you heard today doesn't just happen in a vacuum, and doesn't just happen because, there's crime in this part of town or whatever the case may be. Some of the folks who are, paid public servants who come into the space to protect us, to help our communities, navigate through the laws and the regulations that are set forth, the ordinances that are set forth. Some of those folks are our neighbors, some of them are not. But as we all have experienced at some level or another, we could all use some type of mental evaluation, mental health, or just counseling or therapy to kind of talk to our issues and how we see the world, how we want to go from a dehumanizing, perspective of policing to one that's more encouraging and comprehensive, one that helps build union. As you heard Michael intimate in his piece, there's really, no way that cops right now, for the most part, are, at least in our experience and from the reporting from our folks that we surveyed, there's no proactive way that folks can really see building engagement with police officers. And some of this is just due to the way that they view us in our communities, and some of the policies that may be internal that they don't speak about. Next slide, please. Some of our service providers who may be on this call, moving forward, you guys are doing a great job, as LaToya already said. You are our arms and legs on the ground. You are frontline advocates for folks who come into your spaces, who really, really need the services and really need to be evaluated, and really need these trauma-based services that we're looking forward in policy and creating. But we do have some specific asks, and some of those are educating the public. Some of the things that you heard in this report, and some of the things you probably knew or didn't know, is that you don't have to report a crime to law enforcement to receive services. There are victim services that are available where there's no cooperation with police, there's no police involvement, there's no, going to court. And traditionally, that's been the way that district attorneys and other, crime victim advocates have stopped folks from really receiving these services, even at the introduction to police level, where, if you're not willing to be a participant in telling what or who did what so that we can lock them up, we're not going to help you overcome the trauma that was inflicted upon you. And we all know that's not right. So educating the public and letting them know that there are services out there for them where they don't have to really go against their morals or values, or put themselves in any further harm's way in their own community by doing things that may be viewed as not conducive with the way that they're living in their current surroundings. But we also want to work with law enforcement. We want to improve the reporting process for crimes experienced, and we want to improve reporting and outcomes. Some of those things, are just that. How do we improve the way that we can, make it less cumbersome for folks to report these issues in community, report the trauma that they've experienced, and be able to engage more effectively with healthcare providers in this space, especially on the mental health side. Also improving the accountability process for data collection and reporting, ensuring that accurate data is collected and available for public consumption. Some of those things that we're looking at as a leadership group involve the organization that I work for, also Colorado Criminal Justice Reform Coalition. We do have a C4 that we started last year, to where we're looking at being more engaged with the district attorneys, holding them accountable, not only for just who they're locking up, but why they're locking them up, how they're going about adjudicating these cases, and how they're going about making decisions on who they're going to prosecute, what they're going to prosecute, who they're going to give assistance to, what blocks and things they're not giving assistance to. And so we want to be really proactive in this space to make sure that all reporting is accurate, not just by the police departments, but by everyone who's involved in the criminal legal system, so that the public knows. Makes it accessible so you don't have to go searching through websites or other people's pages to see what's out there, or even getting a third party. Doing the research themselves and being able to find information readily accessible. Next slide, Erin. And also, I'll say this: as advocates, we sometimes lose focus of what we can do. We sometimes lose the momentum in what we can do because we don't really do enough. One of the things I am most proud of right now in the position that I work with and in the organization I work for is not only have we had a partnership with Denver Public Health and the CCBS grant, we've also created a wages program for folks who are returning home from prison. Wages is work and gain education and employee skills, which allows folks to get back into the market, transition more peacefully, transition more effectively. So as we make this ask of you guys, some of the things that we want to be intentional about is investing in community-based solutions to intervene at the level where we know many risk factors for criminalization occurs: education, mental health, stable, affordable housing, and local community-owned businesses. Another initiative that Colorado Criminal Justice Reform Coalition is very proud of and is really getting some traction on is our Transforming Safety program. We like to view it as it's a new approach to public safety. It invests in strategies that strengthen communities as a way to prevent crime in the first place. And if you want to read the bill law, is House Bill 171326. And what that piece of legislature did was it reinvested $4 million a year in parole reforms to create a 3-year pilot in Northeast Aurora and Southeast Colorado Springs. And it does help to fund small business lending, and it also has a community grant side. Any information you want to find on that program is found on transformingsafety.org. So if you do want to take some time and go look at that, there's a website that's dedicated specifically to those efforts. We also want to advocate for greater investment in restoration and healing and systemic transformations through the provision of trauma-informed, culturally responsive, and community-led intervention, Another thing that we're, as an organization, CCJRC is proud of, and we're really trying to get moving, is our Take Care Health Matters program. And that's also has a website where a landing page, takecarehealthmatters.org. And that works to help Colorado seize the opportunity to connect justice-involved people with needed healthcare coverage and services. And some of the bullet points of that initiative is to educate justice-involved folks, develop website resources, participate in relevant stakeholder groups, educate professionals serving justice-involved folks, share info between criminal justice, healthcare, and behavioral health, identify specific issues and/or barriers to access health and behavioral health care for justice-involved folks, just to name a few. Terry, who is our healthcare policy coordinator, some of you in this space may know her. She works with all the Rays and all the other folks who make those decisions, and she's really intentional about trying to make sure that we have a voice at the table. So anything that you guys want to find, please feel free to search those websites, reach out to us as an advocacy organization. We're more than willing to sit and listen, and especially coming from a community perspective, how we want to make sure all the things that are going forward in community are led by community. We've all been, pretty much from grass tops told down to grassroots level, to the advocacy level, what we should be doing. But we all know that in our own spaces, in our own homes, what works best for us may not be the best thing for everyone else. So hopefully these things will be of use to you guys who are on this call, and hopefully there's some advocacy that we can continue doing with the help of community involved. Next slide, please. So as a group, we do want to continue to dive a little further into the research that we started. Well, not us, but this started from Oregon to California. Organization CCJRC piggybacked on this and our Victim Speak report, and the CCVS team, we piggybacked off of that into what you now see as our key findings and some of the reporting documents that we've been able to see in this as well. So as a group, what we're going to do, and Erin can share more about this later on and probably reach out, and Jason as well. We're going to conduct virtual focus groups to further key findings. We're going to document, report, and present new developments as we find those appropriate. And we're going to support the community in implementing changes that support victims. We want to make sure that, Black and brown folks in particular have a voice at the table, especially in victims advocacy. So if those things are things that you want to be a part of, please keep this report in mind, take a look at it. Be aware that we are building our website and on the process of that. And so all of the resources will be available there. We will be sharing the report online, and as well as the organization I work for, CCJRC, will have that on our website also. So we thank you all again. And at this time, I think we'll open it up for any questions that you may have, and I appreciate your time.
I would like to say something in closing. I think my favorite aim of public health is to help amplify silenced voices and to ensure that counter narratives are heard within the dominant social and political discourse. So in short, public health really strives to change the narrative, because you're right, these stories are not interwoven or heard, but stories are powerful. They help us to make sense and meaning out of our individual and collective experiences. And they can also change minds and in turn change policy, and ultimately the very lives and material conditions of real people. And that's what this is all about, because I believe public health happens more so in the legislature than it does in health departments, in LPHAs. And I like to say that before I was in public health, I was a social worker and a therapist. And my favorite modality to use was solution-focused narrative therapy, which upholds the idea that the individual is the author of their own story. And while we might not have a say in how our story began, we do have a say in how our story ends. And I think that holds true for not just individuals, but families, communities, and all of society. And we all have a role to play in determining how our story is going to end. But I want to thank you all again for being present and address any questions right now.
So it looks like there's a question in the chat about
Yeah.
how can I make an immediate impact in my community, examples of action steps I can take as an ally and advocate.
Paula, if I can just kind of jump in there, I think that really what it comes down to, especially in communities of color, is that we need to just really work on fighting the stigma and changing the mentality around mental health. So talk positive, talk life. Know about what's happening in your community specifically, maybe research a couple of organizations or some mental health help-based organizations that you can uplift within your community, within your church, within your realm of friends or whatnot. Start having those conversations, because that's really what changes mentalities at the end of the day.
And can I also say something?
Please.
Yeah, so as far as people go here that are attending, and anybody that has any type of relationship with the community, or if you don't have a relationship with the community, me personally, I came from a background of being on the other side of the spectrum, and I've actually changed quite a bit, and I've began to heal personally, as well as being able to provide other people with the same experience and understanding that I went through as a young person in a community that was economically impacted, or from a house that was broken. And there's so many families out here that are going through a lot of things that people don't realize behind closed doors, and especially now because of the pandemic. And there's a lot more people spending time at home. Stress levels are way up. And, a lot of times it's the kids who are the people who are suffering from all this stress and anxiety. And I really believe that for us to change a lot of the things that are going on is to reach out to our youth in some way and get involved in your community and be able to just start. Because again, I think that's one of the main things that I would like to work on as an individual, is being able to provide young people with that sense of purpose and opportunity, in order to know that there are other things out there you can do to make changes. You don't have to just sit there and take it just because you're young. You can, you have a voice, you have a way to get out there in your community, in your neighborhood, in the city. It can reach worldwide. And I want everybody here that's attending to know that all you have to do is to start. Is to reach out to your community, even if it's just somebody you see on the street, or going to your local middle school or high school and talking with some of the kids. And the staff first. You don't want to just go start talking to kids and stuff, but you want to go and reach out to people in your community and be able to begin a conversation and know what is going on in your own environment that is a problem. And again, a lot of nothing to it but to do it. Just start, and eventually you take that first step, and you'll take another step. And again, just giving people a sense of purpose is awesome.
Thank you, Ray and LaToya. And I would add, yes, start with taking care of yourself and your own potential traumas and mental health. But in terms of being an ally or an accomplice for those who are not directly from these impacted communities, in the wake of what happened with George Floyd and Breonna Taylor, what happens very often is people, white folks, will watch the TV and see these alarming and horrifying instances of brutality, and then they'll feel anger or despair and feel like they need to do something. So they'll go out and they'll hold a sign, or they'll donate money to BLM or another cause. Then they feel better, and then they don't show up anymore, right? But this is still going on, and we still need you. So the key point to all that is to do something. And it might look different depending on what means you have, time or money, or what position or privileges you have where you can be instrumental. But the key is to do something, and that's to take action, right? And like Angela Davis said, and Ibram X. Kendi says now, the opposite of a racist is not a non-racist, it's an anti-racist. And anti-racism is a verb, it's action-oriented. So whatever it is you do, the point is do something. Sometimes it's gonna be uncomfortable, whatever you do, but do something.
And I just want to add too, Jason, just to piggyback on what you were saying, not only do something, but do something consistently. That's the other thing, is be consistent with just, being out there and being a positive force in whatever you guys are doing. So thank you guys for listening.
Yeah, I'd like to kind of also jump in there and just say, something that's a little bit more action oriented than maybe just do something, because everybody's like, well, what do I do? I think that we're dealing with a matter of hearts and minds, and and those are very difficult concepts to wrap your head around. And when you're going at home, when you're at home around that dinner table, chowing down on that fried chicken, or I don't know what y'all eat, quinoa and rice, some vegetables. I'm just messing. That's what I eat too. And some of those conversations pop up that the language is not very progressive. The topics are not very inviting, or maybe some of your friends or your family members are mentioning people in a light that is not really fair. Call it out. And that's really what it takes. Be willing to put yourself in that type of situation where you're saying, you know what, it's not right. It's not right. Don't be afraid to have a conversation. And don't be afraid to let people know, I'm not going to tolerate that in my presence, So that's something, that's a step you can take.
Were there any more questions that anybody had? I know
there was one about how can people advocate to connect behavioral health practitioners and researchers to better to law enforcement and influence how policing, et cetera, goes as public health professionals.
I've advocated, and I would like to have the team advocate with things that I know one of the projects Jason had been working on, which was, again, the STAR project. And, that was basically just pairing up mental health professionals and people who are trained in de-escalation and mental health services to ride along with police officers on certain calls, like, domestic violence calls or disputes and things like that, and keep things from escalating to physical violence. And that's one thing that I feel that would be really helpful, is to be able to not only to train police officers in how to handle de-escalation and handle mental health, but also have a professional along with them to be able to, be that mediator and, not lead to any more shootings or unfair practices, by police officers and communities of color.
That is the big question, right? Or the big solution, if it feels like these days that we're moving toward. I will actually like to just create some space to hear from our younger panelists that might be a little bit shy to jump in on some of these questions and answering these. We definitely want to hear from you guys and what your perspective is. So if you guys have anything to say, don't be afraid to jump in.
Please.
I'm talking directly to Michael and Marcus.
Not all at one time. Not all at once.
I appreciate
Nah,
you saying that, LaToya, because I'm interested in hearing more about Michael and Marcus's experiences and how they are showing up as men of color in their communities for self and for others. So thank you.
I mean, I think definitely I definitely want to reiterate the fact that a lot of approaches that we want to talk about, it do start with community. I think, one of the questions earlier, like, how can I be an ally? And I feel like we just got to be able to get to the point where, like, we got to be able to listen to communities, and we got to be able to come to communities and listen to them. And it's not about what we think that we should do for community. A lot of the practices that even this community research team has is we go to the community and we listen to community. We are the community, and we have the solution. So I think that's the first step. Even if you're white, even if you're not a person of color, it's as simple as getting on something like this and hearing the outcries of the people that are infected and impacted. And I think also, creating that space, having that it is about hearts and minds. LaToya, I agree with you, because it's about, having the heart and having the mind to be able to just sit there and just listen to somebody, but have the heart to go act on it, and show that you really care. And so it may be sometimes uncomfortable situations to kind of hear our stories, but these are the realities for most of us. Yes, I'm a young African-American male from Chicago, Illinois. So I've experienced a lot of these things, and I'm only 19 years old. I've experienced a broken system since a young age, right? Like me growing up, ever since I was a kid, I've never liked law enforcement. I've never felt comfortable around law enforcement because I've had so many experiences, whether I was pulled out, whether I was pulled in, whether I was not doing anything, whether I was doing something. I've had so many experiences where, that have kept me up at night. Like I couldn't sleep. So I definitely, like I said, I think it starts with we got to listen to our communities. A lot of us don't have the voices at the table, and I appreciate y'all creating that space for me and Marcus, because as a youth, we're the ones right now that we're the most vulnerable, and we're the most important, right? To me, it's like we have to be the ones to be able to speak up. We have to have the spaces to be able to do that, because we talk about a lot of these things, but a lot of these conversations, youth are left out. And so that's the unique part about this research team, is that there are youth that have lived it, that have been through it. And it's just the space that has been created for us to be able to use those voices. So we have to create other spaces for other youth, because this is a shared experience across the United States for people that look just like me. Like, it's a shared experience. So we have to create those spaces. If it's giving your spot up at the table, if it's creating an extra seat for the table for another youth or another person that's been impacted, another person of color, and that's what we need to do. So thank you.
Right on, good job. And I just wanted to ask real quick from our younger, our younger panelists. So what with all that being said, what do you guys think is the biggest hurdle to be able to start these relationships in our communities with not just law enforcement, but with mental health and being able to be healthy as a young person of color?
I feel like some of the first steps would be being comfortable enough to speak. Like, even being in these groups and being a part of research, I've had to grow to be comfortable to speak, because you guys have created that space for me. I feel like knowing that we're going to be taken seriously, getting our first perception ain't going to be defining us, and to know that we got more to offer. And I've learned through my experience of being on this team, I've learned so much. My family's been through the system. It's been failed. And I think the work that we're doing in the listening to the youth is really important, because like you said, we're the ones that we're going through it, and our voices want to be heard. I feel like the more that we create that space and let the youth know that, like, we actually want to hear what y'all got to say, what you're saying is going to be taken seriously, I think that's really important.
I definitely agree with you, Marcus. I definitely agree. I think it is that step. But sometimes in certain spaces, I feel like I have the power. For me, I trust in my colleagues here. I trust in this community research team here because I know y'all share so many powerful experiences. But a lot of tables I've sat at, and there's a lot of white rooms that I've been in, a lot of white spaces that I've sat in that I didn't have no solidarity. And so for me, it wasn't like, you don't have to create a space for me, right? Like, this is a space I belong in, and this is a space I deserve to be in. So I gotta step up, and I gotta say what I need to say. And so it's a lot of spaces that's been like that as well. And that's what I share to my other youth. Like, we got to take the initiative as well, too. We got to be the ones to be like, this is us and this is what's going on. We let a lot of adults lead, and it's not their time, right? This is our time. So I appreciate you, Marcus, too, for even sharing that, because, to have another youth even sitting next to me it's important. But like I said, it's for other youth, it's important for us just to take the initiative and say, this is what we got to do. And this is what it is, because we're the ones going through it.
Right.
I'd like to add here, thank you, Michael and Marcus, for your voice. It's so critical. And, a lot of us come to this work from our own trauma and experiences. When I started doing this work with CCGRC and reading the Crime Survivors Report, it really resonated and it hit me. And as I read it, it's like, wow, I'm a survivor, right? And men of color, we typically don't, we're not socialized to ever perceive ourselves as a victim, right? But as I read the report and started doing this work, as a young man of color, I was a victim of violent assaults, and I didn't report those crimes. I didn't have it didn't even occur to me to go to the police, right? There was an implicit understanding that doing so could put me and possibly my family at risk for further harm. I didn't believe the police had any concern for my well-being or interest in seeking justice on my behalf. And my immediate safety was a far greater priority than my healing. So I didn't seek support or treatment, and I believe the only way to protect myself would be to bury any despair or grief that I was feeling, or that I saw as a perceived weakness, and being more violent myself, right? Violence as a means of safety and protection. And I adhere to, we were talking about stories earlier. I adhere to a story that's very familiar to men of color and youth of color, that the world is not safe, especially for people who look like me, right? But fortunately, there were people who were along my path who helped me to disrupt that narrative and understand that safety is a human right, right? It doesn't matter what your ethnic background is or what neighborhood you live in. We all deserve to be safe, and no one deserves to experience victimization or trauma. And I learned that patterns of violence can be disrupted, and they continue to be disrupted, right? Because people were in my path, I now try to stand on the path of violence and trauma for others. And it's great to see people like Michael and Marcus and others like Devana, who's also on our team, coming up behind us and grabbing the baton. Makes this work really, really meaningful and powerful.
Yeah. And just Jason, just so you know, also being a person who's been beat up by police officers in 3 different states and the District of Columbia, I appreciate you giving me opportunity to, change, and hopefully that's the other thing. I want to make sure that our younger team members don't have to go through stuff like that, because it's never good to be involved in situations that require, I guess, physical altercations, you know what I mean? And so I just wanted to say thank you to everybody on the team for being here to help with healing, with a lot of our issues as well, our own personal issues. So thank you all for being here for me. And I just wanted to, let everybody know that.
I must admit I have to gather myself because I'm in an emotional space right now. So just really want to say how much I really appreciate each and every one of you for the work that you're doing. So I'm going to take a minute.
Take all the time you need, Paula. That's good. I'm glad that you know, the things that this is the most important part of what we're doing as the team is making sure that people feel those emotions, because a lot of times, you know, being in the situations in the communities where we live, that's, you know, I was just explaining to my team the other day, I've had a lot of friends and people I know killed in the past year, you know, like a lot of people. And, you know, like LaToya just messaged right now is, you know, to reconnect to humanity. And that's one of the things that I think as a society and as communities, we forget that, you know, we forget that people are human beings, and we need to make sure that we are able to have that compassion and that connection to everyone. And again, that's the reason why I believe that reaching out to youth and showing them that they matter is a very important thing, because, you know, they're the ones who are going to turn around in 10, 20 years and be the ones to give back to their community and their neighborhoods and their families. So, like, you know, a lot of times we just need to step back from where we're at and see that we are all connected in some way, regardless of your skin color, your status, or your economic position. We all are human, and we all have the same needs mentally and emotionally. And, you know, again, I just feel like that's something that we really need to get back in touch with, and be able to know that we have that compassion and that capacity to care for, you know, one another.
Henry, I saw you on mute. Would you want me to share something?
Oh no, I at the time I was unmuting. No, I think it was just intentional to be in this space. You know, that was it. I just wanted to kind of be fully in present. So I had a moment. I'm kind of like Paula, you know, and it's you start thinking really about how this work has changed all of us at the table. I know how we all came to the table originally, and how we over this last almost 2 years now have really grown and developed in this space, and trying to be advocates for mental health, and how it's affected me in the work that I do. So like Ray said, I'm grateful for the space being created. Marcus and Michael, and you know, Devano and the youth that are part of this, who have, you know, kind of, you know, kept the flame burning under us to make sure that we remember what's coming behind us, has really been helpful to have them in the space as well. And LaToya and Erin and Janet, who's not here, you know, having women and women of color in particular to really make sure that we stay intentional about the work that we do. So no, I just, you know, I forgot the comment that made me unmute, but yeah, it just kind of drew me back into the space. But I appreciate everyone for showing up, and for hearing this report. And Jason's got his email in the chat, so please reach out to him if you guys have any suggestions for us. But yeah, I'm good. Thanks.
Yeah, I feel like we've been through war together. You know, it's been a hell of a year. Of course, for everyone, but our leadership team has experienced some pretty significant losses. You know, deaths by you know, homicides. People have experienced violence themselves in our group, lost loved ones, and I think it's. I hope that it's definitely made, like, the individual contributions of each member of the team has made us stronger as a collective, but I feel stronger as an individual having worked with these folks, and it's been an amazing experience. Probably the highlight of my professional career for sure, and highlight real moment of life. If any of you who have participated are interested in bringing us to your organization to share these findings and to continue to get the word out, please don't hesitate to reach out. We are the Wu-Tang Clan of research.
Hey, I like that. And it's funny that you say that, you know, it feels like we went to war together, because I was just reading something about, you know, a quote from one of the soldiers on the front line. And he says, you know, a good soldier doesn't fight because you hate what's in front of you. A good soldier fights because you love what's behind you. So that is really good. And Wu-Tang forever. Thank you, guys. Thank you, everybody.
Thank you all so very much for being intentional and for being courageous. I don't, y'all have left me speechless, and if anyone knows me, that's hard to do. But I want to encourage you to continue to do this work. Let us know how we can lean in and help you as well from the Center for African American Health. And at this point, I don't see any other questions, but are there any final thoughts before we take a break and move on to the next sessions?
I will say, I think Jason and I both put our contact information in the chat. I saw LaToya did too. So if you're interested in the report, it just got finalized this morning, so we can send it out. So please reach out for that. And then we also will be reaching out to organizations to start recruiting for focus groups soon. So we would love your support in getting connected with people. And it'll have a flyer where they can pre-register on there as well.
All right, well, with that, I'm going to say thank you, stay safe, keep well, and I look forward to seeing you all throughout the rest of our day together.
Thank you very much for having us. We appreciate it. And keep up the good work.
Thank you.
And don't forget to reach out to us, anybody. Thanks a lot, guys.
Thank you.
Take care.
Take care.